So yeah, my name's Elaina Lorefice. I am from Long Island, New York. I live in Williamsburg, Brooklyn in New York now. I graduated in 2019 and yeah, I chose URI for the pharmacy program because it had like the most homey feel. The program's super, I would say in general, just very well organized. The class size is perfect. I really enjoyed like the collaborative working environment that URI provided. So I think that overall it was just the most well-rounded program out of all the pharmacy schools. And like obviously Rhode Island's wonderful, and the professors are super down to earth, open-minded, willingness to teach, willingness to get feedback. So yeah.
Right. Yeah, I'm from Narragansett. The in-state aspect definitely helped me out, but I totally agree. I really like the 0 to 6 is big for a lot of people, in that you don't have to kind of like compete for a spot after a couple of years. But yeah, I mean, I think like the location of URI, it is kind of like a homey little, it's like tucked away in a little like small town. I don't know, it feels cool.
Yeah, exactly. I totally agree. It's not like a large city feel, and it has like the campus, and it's like a community feel.
Right. So what has kind of your career looked like since graduation?
Yeah, I had kind of a unique path, because in New York, we kind of getting into like my career path now, we have a compounding exam, and the year that I took it, I didn't take it until June. And I kind of had a few different plans worked out. I was originally going to start working at this hospital I was working as an intern at. And in the midst of like me awaiting my pharmacy license, I took the compounding exam. I had been doing some like just job searches for just put my name out there, see what comes up. And I originally started, so I did medical writing for a bit, probably from I think June graduating until around October, November-ish, when I started my job that I have now. And the reason I did that is because you don't really need to be a fully licensed pharmacist. You're just going to have this healthcare background, a certain degree, certain skill set. And the opportunity was super unique at the time, and it kind of fit my needs. I wanted to move to the city. The hospital that I was working at was super great, but it just didn't seem like the best move for me at the time. So I started working there. I definitely enjoyed it a lot, but then my opportunity came up to work where I do now as a compounding pharmacist at MixLab. Yeah, I'm not sure if it was mentioned at all, but it's like a veterinary compounding pharmacy. So it's a little bit unique in the sense that you don't really get any training on that in school.
Right.
And compounding itself is like something that you don't really, you get like the training that will get you competent, and like, it's kind of like a unique path to take, but I'm sorry, that's my work channel. But yeah, so I basically started at my current job called MixLab in November of 2019, and I've been there since. Yeah, so it's basically like a little bit of a mix of veterinary compounding pharmacy, as well as we do like retail side of stuff. So like commercial medications. There's obviously veterinary specific medications that you kind of have to learn. But yeah, I love it very much. I was very lucky.
You mentioned the New York has a compounding specific exam. Is that like an optional thing if you're practicing in New York, or all New York pharmacists required to do that?
Yeah, so all New York pharmacists are required to take it if you haven't practiced pharmacy for a year in a different state. So basically, if I was in Rhode Island, got licensed in Rhode Island, and worked as a pharmacist for a year, you can reciprocate that license to New York without having to take it. But since I was planning on working in New York right out of the gate, we have to take the law exam, the NAPLEX, as well as the compounding exam. So it's kind of a decently rough summer, but you get through it.
Is it like a similar to how the NAPLEX and the MPJ are done, just kind of like a multiple choice kind of thing? Is there any like in-person kind of aspect to it?
Yeah, for sure. So there's actually a couple, I forget exactly what the breakdown is like, but there's one day where it's more of like a written test. I don't know. There was like some matching, maybe some multiple choice, definitely some freehand, a lot of like brand and generic names. They kind of mix up everything. So it is a lot of like just random clinical knowledge. You have to know like drug interactions and brand generic for the first day and just counseling points and all that stuff. And then the second day is just like a full day of compounding. I think there's 3 different compounds or 4 different compounds you have to make. One usually an IV. Then you could get like a suspension, capsules, a few other things like creams, ointments, and stuff like that. But I believe you get 3. Don't quote me on that, but I'm pretty sure it was 3. And then, yeah, just like 2 very long, intense days. But I definitely think I did a rotation at a compounding pharmacy on Long Island for 6 weeks, and it did prepare me enough to be like comfortable with like weighing stuff on the scales and all that stuff. But a lot of the places you take it offer review courses as well, just in case that's like a tidbit anyone needs to know for graduation.
Right. That's interesting. Wasn't really sure about how that worked.
Yeah, yeah.
So as far as being a compounding pharmacist, like what does a typical workday kind of look like for you?
Yeah, so if I'm like specifically in the lab at my compounding pharmacy, it's a lot of you walk in, you make sure the hoods are clean, you record the temperatures, make sure all the dishes are clean and up to par. Then when you get into like actually making medications, so at my pharmacy, we don't do sterile compounding, so we don't do ophthalmics, injections, ointments, eye drops, like ophthalmic ointments or eye drops, things like that we don't do. But we do capsules, tablets, chew treats since it's veterinary, suspensions, topical ointments, ear drops, topical sprays, what else? Bunch of different like toothpastes, a lot of different random things, especially it being for animals. It's you do see a lot of like unique stuff. But yeah, a lot of it is definitely tons of math. That was probably the biggest like learning curve for me was there's tons of like calibrations and learning how much a tablet weighs so you can get to like how much active ingredient you need in order to produce the product. But yeah, I think throughout the day it's a lot of I have oversight of a few technicians as well, so making sure that they're in compliance with everything that we're doing. And then when we're going to compound this stuff, it's just a lot of planning. Like you have to make sure you have all your materials in the hood before you start touching active pharmaceutical ingredients, and just understanding the steps for like what you're about to make before you tackle it. Once you're in the hood, don't leave the hood, make sure gloves are clean, change gloves, garbing, all that stuff. So
Right. And the actual compounding itself, is that something you do as well, or is that maybe like something more technician, like more of a technician responsibility perhaps?
yeah, no, I definitely am compounding lots throughout the day. There's some tasks that compounding technicians can do in New York, some that they can't, but yeah, the compounding pharmacists where I work, we are compounding the entire day if you're assigned like the lab.
Okay. So is there another kind of form of assignment per se?
Yeah, so since it's kind of a mix between compounding and like a retail setting, there's I could be doing verification outside of the lab. So it's like more of the commercial side, as well as we're verifying the formulas that we've used to compound the medications with. So every time we complete a compound, we print out a logged formula worksheet from the software that we use, and the pharmacist that's outside of the lab is like our double check for that. So it's kind of 2 sets of eyes, maybe even 3 sets of eyes if there's another pharmacist in the lab with me, to kind of double check the original formula that I use. So everything that we make requires a formula. So I'll make it, another pharmacist will double check it, and then once it leaves the lab, it goes to another pharmacist. And then as in addition to them checking the compounded medications, if that owner happened to also get a commercial medication or answering vet phone calls and all that stuff is kind of like outside the lab.
Okay. So it sounds like you're working with, or maybe you're working somewhat closely at least with like other pharmacists and then your technicians. Do you have a lot of interactions with kind of other types of providers or healthcare
Yeah,
professionals?
yeah, a lot. I would say a lot of the times, I mean, just working in, veterinary specific pharmacy, it's a lot of veterinarians, obviously, as well as veterinary technicians. And then just within my pharmacy, we have tons of different roles. So there's the compounding technicians, then there's technicians that are typing outside. So like technicians that you would see at CVS or Walgreens, like in the retail setting, similar to that. Then we have like we have tons of like leadership roles. And then we do have like salespeople for our pharmacy. So definitely a lot of like internal communication, as well as I would say like most of our communication is going to be with veterinarians, veterinary technicians, and then like our wholesalers, like the people who we work with like Mediska and PCCA to get our products from, our active pharmaceutical ingredient like powders from.
Right. Would you say that there were any like particular maybe skills that you had or maybe experiences that you had in the past that made kind of getting into compounding pharmacy a bit easier? Or are there any traits that you find that you have that make performing as a compounding pharmacist to be a bit better or easier?
Sure. I would say like experience wise, I had experience at the hospital that I worked at. So I didn't make any sterile products, but I did compound tons of suspensions from like tablets, from capsules, from just powders. So I think that definitely helped me, as well as doing the rotation that I did at the compounding pharmacy. So most of my responsibility there was just compounding, like all day long for like 8 hours a day, 9 hours a day. So it was a really good immersive experience on sterile and non-sterile and garbing. And I was lucky the preceptor there like gave us a lot of responsibility. So it was very much so like you kind of like were immersed in it. I guess quality wise, you definitely have to like be a critical thinker, just because there's a lot of, well, is this like water-based suspension in this oil, is that going to mix okay? What do you think about increasing the tablet mold size for this specific drug? Or it's tons of trial and error. Like sometimes there are things that we'll just like obviously not send out if it's something that we don't feel is a good product. So I think especially early on, so my company's startup-esque, but we've been in business for about 4 years, me there for about a year and like 7 or 8 months now. So in the beginning, the early years, there was tons of like trial and error, figuring out what worked, and it's still always going to be that way. So I think just kind of thinking on your feet, being able to multitask, being able to get feedback from peers, like I think a skill that really helps just being a pharmacist in general is admitting like when you don't know something, and like when you like need to ask for advice on something is probably the most valuable thing I think anyone can like use in general, is just like be okay with like not knowing it. Like there's not a shame. Like you'd rather ask the question than be like, well, maybe it's right, send it out, and then something happens that's undesirable. So yeah, I would say just critical thinking, being able to multitask, being open to change, and then yeah, just being open to getting feedback, asking for help and stuff.
Totally. So you did have the compounding rotation. Did you know, like maybe before or after that rotation, that compounding was something that you wanted to pursue further?
I knew that I really enjoyed the physical compounding aspect. It's kind of something, I think if you like working with people and then you also like having like a task at hand, it's a really good job. And if you like to bake, if you like to cook, if you like to like just like be physically like on hands with stuff, I think it's a really good career path. My days fly by. That's like, it's a good and a bad thing, I guess. It's like you're like, well, where did the time go? I have a lot to do still. Or like my days are very fun. So I'm very lucky in that sense. Like it doesn't really feel like work. I'm not totally, I don't have tons of experience elsewhere, but I know at my hospital, I really enjoyed it. And then at my job now, I really enjoy it. So my days kind of flew by at the hospital and they fly by here, which I think is a good sign. So if you're the type of person that likes hands-on learning and hands-on, like I said, cooking and baking, they can kind of be transferable skills. So.
Right. Yeah. I mean, personally, I've always enjoyed just like doing things with my hands, I guess.
Yeah.
Even kind of lately, I've helped out a little bit at like COVID vaccination kind of clinics, just drawing up vaccine doses. And it sounds boring just drawing up like the syringes of COVID vaccines, but it actually does make the time go by pretty fast. So I can imagine
Yeah,
then when you're making products that are a bit more involved, then it goes by even faster, I'm sure.
for sure. Yeah, that's super cool though. Good for you.
Do you have a favorite part or like a most rewarding part of your job?
There's definitely a lot. Like I feel my job satisfaction is very high. Like I really enjoy what I do. I'm very lucky. So I think a lot of the times we hear back from the owners of pets, and they're just so grateful that we're able to, get them the medication. So we're kind of this company that either gets it to them same day because it's in Manhattan, so it's pretty easy to get around. And if we can make it, we will, or next day. So I think just being able to like have that, okay, well, I made the medication, I took the script, I verified the medication, I got it to the owner, and they send you like a personal message that's like, I would say almost 80% of our owners or clients or whatever you want to call them, customers, are always like super grateful. I think even the veterinarians that we work with, so there's like not a big gap between, I would say that veterinarians and pharmacists think very alike. So there's a very collaborative feel. There's no like, I know more than you type of feelings. It's very like, well, what do you think about this? Or what kind of product would you get? Or, how do you compound this stuff? So they're like very open to hearing our opinion on stuff. We're open to like learning more about veterinary medicine because as pharmacists, like in school you don't technically learn about it, but it's a lot of on the job training here. So compounding wise and just like medication wise, it's very collaborative. So I think that that's like super rewarding, is just being able to like, I'm constantly learning, I'm constantly asking questions, like giving advice on what I think is like the best recommendation. So yeah. And then obviously like making medication is super fun.
Right. Yeah, I think it's like the idea of kind of learning the medications outside of humans is super interesting. Like, has that been maybe like an obstacle trying to learn how like medication use works in different species of animals, or is it something that has kind of maybe come a bit more naturally? Do you enjoy that? I guess animals are your like main kind of focus.
Yeah, it's still like a learning curve. You're never going to know everything, especially in my field. It's constantly changing. And the difference, I think, between animals and humans is that it's almost like pediatrics, where a lot of it is like weight-based dosing, BSA dosing. And then the products, the strengths, the brand names are like, I would say a lot of animals do take human like brand names or commercial medications, but then there's just specific products that you kind of have to learn. And then even like powders, when I'm compounding, there's specific like APIs or active pharmaceutical ingredients that only animals can get or only humans can get. So it's kind of like that learning curve. And then also just diving into like the compounding portion is a lot of, when you do take your boards or when you take the NAPLEX or the compounding exam, if people are going to take that in New York, then it's a lot of like learning what's the beyond use state for this. Like it doesn't have to be refrigerated. What's the storage like? What do I have to communicate to the owners? Is there a specific light sensitivity? Is there a specific pH we have to worry about? So it's kind of like yes, you have to learn the veterinary side, but then the compounding side, since I was a new pharmacist, when I started working there, it was a lot of learning off the bat. But it's always going to be that way in a good way. I think that that's,
Right.
it's fun. It's not like you kind of go to work, do the same thing and go home. It's every day is like, how do we problem solve? How do we collaborate? Like, what's your opinion on what type of base we should use for this? So we do make trochees for a specific college like research center here for like monkeys that they do like testing for. So it's kind of cool because you're like part of this research that they're doing there, and you're making the trochees. They're like dissolvable lozenges that are really fun to make. They're kind of like candies for the monkeys. So it's super cool to kind of like work in a few different environments and learn different things.
Right. Do you have direct interactions with, say, like the pet owners when you're working in the retail, I guess like the more retail setting of the pharmacy?
So we do have people who come and pick up from us, but I would say like 90 to 95% of the time, it's a lot of delivered products. Like, so we have couriers who bring stuff, and then we also use a few different delivery services like FedEx and UPS and a few different companies. But there are a few times where I'll personally deliver something if it's like on my way home, and I'll talk to the owner a little bit, or when people come and pick it up, I'll counsel them on stuff. We do a lot of like texting and emailing with the owners and phone calls. So it's more of like a virtual interaction as opposed to an in-person interaction.
Okay. Let's see. How would you say that URI has prepared you for your role as a compounding pharmacist?
Sure. So we have that one semester of lab in, I think, P1 year, is it, or P2? I forget. I'm not sure what the curriculum is like now, but when I was in pharmacy school, we did have, I think, one semester of compounding lab. I think that like URI's compounding in general, it's not like a super big focus because it's not something that like a lot of people go into, and then it's not like an exam that is usually required of like 99% of the people that go there. But I do think that our compounding lab, like we had super great TAs. It definitely prepares you for the compounding exam, and then URI like is really good at setting up sites that will give those people who need more experience compounding for whatever exam or for whatever career they're choosing. There's tons of electives. So yeah, I think the lab itself prepares you, and then in addition to that, the options for electives in your APPEs is great.
Mm-hmm. Yeah, I mean, so I'm in APPEs now, but it is quite a long list of APPEs to kind of go through, and it makes it really interesting because I feel like even just looking at the APPEs that are available, you find out about like career paths that you never even knew existed, which is
Yeah,
really interesting.
sure.
So yeah, it is. I would agree that you can be set up for just about whatever you're interested in through, I mean, you get a lot of exposure to a lot of things just in the basic curriculum, but like APPEs in particular can really give you a good idea of what different careers are like. So it's cool that you kind of got that direct experience and were able to use it to prepare for the exam, and then eventually in practice get to put those kind of skills to use.
Yeah, and I think a lot of the skills that you'll use as a compounding pharmacist like are found within a lot of the courses at URI. So like just the like math like in general is something that you're gonna see tons obviously throughout school. You're gonna see the different drug names. You're gonna know what commercial tablets there are that you might need to crush in order to compound or whatever it might be. So I think that even though there's maybe not a specific like in the class course, like a super long, year-long immersive, maybe specific to compounding experience, there's definitely just skills throughout the 6 years that you're at URI that you're going to use
Right.
as a compounding pharmacist for sure.
Yeah, something that kind of sounds unique to compounding is the amount of math that's involved, and I can imagine you probably do a bit more math than maybe the average pharmacist would. Would you say that most of the math is involved is with like calculating doses, or does it have to do more with like deciding how much of which ingredients to use to make the product the way it should, if that
Yeah.
makes sense?
Yeah, I think in my specific field, it's a lot of both, just because, like I said, everything's kind of weight based. So you're kind of looking, since dogs can range from like, or cats or whatever, can range from like 4 pounds to like 150 pretty much. It's pretty important, obviously, to make sure that the medication you're giving them is correct for their weight, their BSA. But then in addition to that, like you said, figuring out how much active ingredient you need in order to distribute it evenly throughout the product that you're making, or it's a lot of percents, a lot of, there's things called loss on drying and assay that you have to account for, and salt adjustments. Like, for instance, so clopidogrel bisulfate is a salt, so it's but when you're compounding, you have to take into account that salt component. So that salt component, when you look on a bottle of clopidogrel, it's labeled as clopidogrel, and then if you look in fine print, it's like, this is 75 milligrams of clopidogrel formulated as clopidogrel, whatever the factor is. So 75 times, I think, 1.304 is the clopidogrel bisulfate. So when you're compounding, you have to take those salt adjustments into account. You have to take the assays into account. You have to take the loss on drying into account. So it's a lot of division, a lot of multiplying, a lot of percents, a lot of figuring out, okay, you're allowed to have like a 10% plus or minus yield on your product. So say you need 10 milligram like tablets of, I don't know, whatever drug, and you want to make 50. What's acceptable in compounding standards is if you want to make 50, you can't get plus or minus like 10% of that. So basically 45, 55. We try to, even at my lab specifically, our scales are set to only allow us at 3%, plus or minus. So if I need to weigh out 1 gram, then I can only go plus or minus 3% instead of, the 10%. But when we're making the product, it's certainly it has to be within like the 10% range. And then we're figuring out with our capsules, like based off of how much powder we had total at the end inside the capsules, we weigh them, we divide, we find out how much each capsule weighs. We're making sure that there's a lot of like quality assurance involved to like make sure our products are correct. We've sent tons of things out for testing. So you basically use a company that's going to say, okay, you compounded this product, like what is it actually? So if you want it to be gabapentin 75 milligram capsules, is it actually that? Like, so they use their light spectrometry and all this stuff to figure out like what is actually within that capsule. So we get good results on those as well. It's kind of like for our own quality assurance to make sure that what we're making is actually what we say it is.
Right. Yeah, it definitely sounds like a pretty like maybe complex process, and I imagine that like you have to put a lot of effort into being as exact as you can, just because you don't want to cause any, obviously you don't want to cause any problems with the recipients of the medications you're producing. Definitely could see that maybe being a bit difficult or just requiring a lot of attention.
Yeah, it's definitely, you don't want to have an off day. You want to like be on all the time. But it's always good. And then like just being able to trust your other pharmacists that you're working with, and even the technicians I work with, like if I just need a quick double check and they know how to do the math, and I know I can do it alone, but I'm just like, it doesn't hurt to like always have a second set of eyes, or, just someone peering over your shoulder. It's always helpful to like work in an environment where there's no like pettiness, like how did you not know this? My job is, very much so not like that. We're always like trying to help each other because we're all learning. So I think my biggest advice, even in general as a pharmacist and like compounding specifically, is just don't be afraid for that second check. Don't be afraid to like have someone else look at your dosing or whatever it may be. So yeah.
Right. I think that is pretty much it for the major questions that we wanted to kind of hit. So if there's anything that you want to add, I'll kind of give you the floor, or if there's kind of any advice that you would give to either a student who's going to be going to URI in the pharmacy program, or maybe just a general student who might be interested in pharmacy in general, maybe any brief advice that you might give to those people.
Sure. So I guess my advice for people who are thinking about going into URI is you should definitely go to URI. It's a lovely, well-rounded program, well-rounded people, well-rounded professors, super fun, super engaging. You learn a ton. Definitely being in practice for the almost 2 years that I have. I know it's not a ton, but I'm very lucky where I get to work with like students from other schools, pluses and minuses, and it's really tough for me to come up with like a lot of minuses for URI. So that's just my own spiel about that, is that I personally don't have any negatives to say about URI in general, the pharmacy program. I think that the communication between all the professors and the students is very like, there's an open floor. I never felt intimidated by anyone, like always could go to anyone for questions, or if I had a thought about something, it was always welcome. So that's for the students who are thinking about going to URI. The students that are at URI, my advice is to enjoy the heck out of it, and definitely connect with as many of your peers as possible. And then as well, just don't be afraid to like join a bunch of clubs. I know grades matter, but like 5 points here and there is not going to make or break your career. You're still going to come out a pharmacist, but like study hard, get the job done, have fun, get tons of mentors, get a LinkedIn, and then look at pharmacists from URI that you can connect with if they maybe have a career that you're interested in. That's actually how I got a lot of experience, was just looking on LinkedIn and seeing what jobs were out there. Like, don't close your doors just because you get you have a sure set path. It's you're young, I'm young still, there's tons of opportunities out there, so just keep an open mind, don't stress about it, everyone's going to be fine. You'll find your path, whether it's residency, whether it's retail, whether it's something different. It's gonna fall into place. So that is my advice for people who are at URI now. And then I guess advice for like you, or like people your age that are about to like graduate and head on out. It's pretty similar, like just enjoy it, don't stress, get your boards out of the way. Be open-minded, be willing to try new things, be, I guess, passionate about what you do. I think that helps a lot when you find a fit that you're enjoying. Like I said, I'm very, very lucky. My job doesn't feel like a job a lot of the times. I work very hard, but lucky enough where it's not something that I'm like running away from. It's not something where I'm like, oh, I need a vacation. It's great. So I think if you find a fit where you feel passionate about it and you feel like you're enjoying your day to day, you have great colleagues, and it's just overall a life learning type of environment, then I think you're all set to go.
Right. I appreciate all the advice. Even from me.
Yeah. What do you think your path will be when you graduate?
I'm still unsure. I'm kind of in the process of looking around to see what kind of is available.
Sure.
I'm from Rhode Island and living in Rhode Island, so primarily looking around Rhode Island and then maybe a little bit into like Connecticut and Massachusetts. But I'm not sure yet. I mean, I have experience in like hospitals and retail, and I've enjoyed both. So it's hard for me to say what I'm going to end up with. I'm just trying to like keep my options open, I guess.
Yeah, for sure. think that another thing people can do that's an option. I know at my hospital, what a lot of people did was they either worked retail part-time and then worked per diem at the hospital, or they did full-time as retail and then worked per diem at the hospital, which is a lot. But if you're feeling motivated enough, like to do both, that's like tons of people do that too. So.
Right. But it's like, as I've been going through Appies, I'm finding that I basically like everything that I've done on Appies so far, so it doesn't make it much easier to like kind of settle on something.
Sure.
So
Just
yeah,
keep your doors open, like you said.